Good morning, everyone. My name's Jeff Cooper. I'm Montgomery County Health Commissioner. Thank you for being here today. I'd like to formally welcome everyone to the Everyone Should Turn 1 Infant Mortality Conference for Montgomery County. This is our first ever conference on infant mortality. That's phenomenal. First of many. We're happy you're here today, and the reason being because it signifies that you share our concern regarding the health of our infants and our need to improve our infant mortality rate and reduce the number of infants who are dying. So, what are the goals of this conference? Certainly raise awareness. I mean, think about that for a minute. There's not a day that goes by that there's not some sort of media attention directed to the drug overdose issue in our community. You could survey every household in this county and everyone is aware that we have a heroin/opioid/fentanyl problem in this community and in this country. That's not the same level of awareness that we have regarding infant mortality. That needs to change. So today we look at as a defining moment for this county. We all want the same thing, okay? Think about that. Every single person here wants to make sure that Montgomery County is a healthy, safe, and thriving community, all right? Pretty clear. And that applies to all the cities, villages, and townships within our border. That means, though, to achieve that vision, that means that all 534,000 plus residents in Montgomery County, and this is really important, have equal opportunity to achieve the best health outcomes. So if we're going to make improvements in our infant mortality crisis in this community, we're going to have to focus on equal opportunity. So we're going to have to look at things differently. And we'll talk about some data here in a little bit, but if we simply continue to apply more resources and build capacity in our existing strategies and initiatives, we're going to be here 5 years from now showing the same data with very little improvement. So we need to be creative and we need to think differently. We have to make sure that all residents have equal opportunity to become healthy. So we need strategies that raise awareness, strategies that eliminate barriers to good birth outcomes. And we all know there are many barriers that our populations face regarding healthy birth outcomes. We need to reduce our overall infant mortality rate, and we need to reduce the racial and ethnic disparities in those infant deaths. So what can we really say about the situation and the scope of this problem? We have shared ownership of this problem. Think about that for a minute. The state of Ohio has declared infant mortality a public health crisis. We have shared ownership. We have a high level of urgency. Commissioner Lieberman indicated it. The other speakers today will indicate it. Our numbers are unacceptable. But the fact that you're here today signifies your commitment to making a difference and that we can all work together to show improvement. So let's define the crisis for a moment. We all know we have a problem, but let's start with the data. We have an impressive list of presenters today. Take a look at who's presenting in this program brochure. We have subject matter experts from all fields in terms of improving health, safety, and welfare for mothers and infants. And thank you for being here today. And they're all going to show you a lot of slides on data. We're really good at collecting, analyzing, interpreting, and disseminating data now as a community. And those data, though, as you listen today, they're basically variations on a common theme. And that common theme is that Montgomery County has been working on this public health crisis for a long time. But our historical activities have not yielded the desired results. That's the reality of where we stand right now. And that's particularly true in terms of reducing the racial disparity. So let's put this in context for our county. In Dayton, infant death data began to be reported in 1912. And at that time, infant deaths were about 16% of overall deaths for the county. Leading cause of infant death in 1912, prematurity. Does that sound familiar? So by 1920, Dayton started to record infant mortality rates. However, that was for white infants only. 85 infant deaths per 1,000 live births among white infants in 1920. Certainly, that rate was higher for black infants. It simply wasn't recorded at that time. So those racial disparities, though, began to be reported in the 1930s, and they have persisted to date. So we have made progress as a community in terms of reducing our overall infant mortality rate. We've made progress, quite frankly, in reducing the white infant mortality rate and the black infant mortality rate over the past 100 years, but we've not made progress in terms of reducing the racial disparity. Those racial disparities persist. That's a problem. We don't want us to be defined by that racial disparity as a county. So where do we stand today? Montgomery County continues to experience one of the highest infant mortality rates in the state. Year after year, too many babies are born too early, too small, and they die before their first birthday. We all know that. 70% of our infant deaths are in the first month of life. Black babies are dying at a rate 3 times the rate of white babies. Enough is enough. So what do we need? Today serves as a call to action for all stakeholders. These trends are simply unacceptable, and you'll hear that by all the speakers today. And quite frankly, most troubling are the fact that these racial disparities have persisted over time, for over 100 years. And prior to that, we simply don't have the data to demonstrate it. So that call to action, quite frankly, is the Montgomery County Infant Mortality Task Force. You'll hear about that today. Near the end of your program, you will see a flow chart or an organizational chart and some goals and objectives for this Infant Mortality Coalition. That doesn't mean that we want to dismiss the good work that's currently occurring and has been occurring in this county. Many organizations have been working diligently to improve the health, safety, and welfare of infants and mothers for many years. But the problem is we're not moving the needle. So the purpose of this task force is to say, number one, we're going to raise awareness. Number two, we are united as a community to make a difference. Every single person in this room needs to be a part of that process because we have to break down silos and we need to move forward together. So infant mortality is a public health crisis that requires a unified strategy to move forward. And that task force is going to develop that strategy. So what do we want to do? We want to reduce preterm births. We want to reduce substance use and misuse in pregnant women and mothers of infants. And we want to reduce that racial disparity. We know the neighborhoods and the communities we need to focus on. We've outlined that in our community health improvement plan. There are specific zip codes that we need to address if we're going to reduce that racial disparity. All right? So what are these strategies going to look like? Well, certainly we're all aware of the phrase social determinants of health. Those are really the underlying issues that are the key drivers of health outcomes. So what do we need to do to show improvement? We need to work on issues such as food access, transportation, stable housing, stable employment, educational attainment, freedom from violence, reduction in stress. Multiple issues that need to be addressed and incorporated into every strategy that we develop through this infant mortality task force. So if you look at the program, you will see the organizational chart. And the areas that we're going to focus on are going to be preterm birth and low birth weight, education and information, reducing substance misuse, prevention is a key component, community engagement, Fatherhood Coalition. All of those initiatives need to be looking at the social determinants of health if we're going to make improvements in this arena. So, in closing, as we stressed early, the infant mortality issue in this is a community problem. It's a statewide problem. We have to agree that we refuse to continue to be defined as a community with a high infant mortality rate and a racial disparity in infant deaths. That's simply not acceptable. In 2015, if you look at statewide data, 1,005 infants died before their first birthday. 50 of those were Montgomery County infants. From 2006 to 2015, a 10-year span, 10,763 Ohio infants died before their first birthday. 531 of those were Montgomery County infants. That's enough. And that racial disparity is pretty high in our community. So this task force, it's critical that it move forward and unite this community, and that we have goals, objectives, key activities. We do program evaluation. We hold ourselves accountable as a community, and we say we're no longer going to be defined as a community with a high infant mortality rate. So, by working together, we can achieve our vision. Montgomery County is a healthy, safe, and thriving community, and we do that within the context of reducing our infant mortality rate and those racial disparities in infant mortality. So thank you for being here today,